Hello, and I am Aaron Wallis with Engaging Arkansas Communities, and today I'm joined by Dr. Bala Simon, who is going to talk to us about mental health. So, hello,
Well,
thank you for joining me.
well, thank you for having me. Mental health and substance use, as the theme of the conference, talks about the bigger societal issues. 1 in 4 Arkansans deal with some form of mental health disorder. And these are the people who are diagnosed with some form of mental health disorder. When I mean by mental health disorder is it could be depression, anxiety, PTSD, you name it. And on a corollary, the substance use. Substance use, again, 1 in 5 Arkansans are dealing with some form of substances. Oftentimes, one is used to cope with the other. Substance use is often used to cope with the mental health illness. Part of the problem is we are in a resource poor state where we don't have an adequate number of providers who can help with mental health. It starts with the family doctor who can talk to the patient about how they're doing, not just physically, but also mental health. You know, how are they with their headspace? And screening them for mental health disorders like depression, anxiety, PTSD, and so forth, and providing them opportunity for resources available. On the other side, the substance use, similarly, it starts with the family members identifying there's someone in our family is struggling with substance use, either it be tobacco, alcohol, prescription drugs, or illicit drugs. Oftentimes, people who don't get help for mental health resort to other things to cope with that. This could be as simple as food. We all have a bad day at work and come up, take a big bowl of ice cream and sit in front of that. And if it is 1 or 2 days, that's different. But if it's going to be the norm, it's going to take a toll on the health. Same thing with tobacco use, same thing with alcohol, and same thing with drugs.
What advice would you give to someone who's don't like? How do you stop from doing that to yourself?
That's a great question. So, mental health and substance use are really a spectrum, right? We all go through our lives with ups and downs with the moods, but when it becomes a problem is when it impacts your day-to-day work, impacts going to school or livelihood. Then that's when the mental health becomes a mental health disorder. Similarly, substance use, if you have a can of beer or if you have your regular medications or having trouble to sleep, you take a sleep pill and go to sleep. But it doesn't impact your other lifestyle, that's different. But if it does, then you're not going to work, you're not going to school, it's going to impact, right? So oftentimes the family members are the first people who can notice. Take time to talk. In this day and age of electronic media, it's easy to get carried away. So it's important with family members identifying then my son or my daughter, my sibling is not well. Let's sit down and talk. Same thing, identify, look for substance use. Are they using the pills? Are they using tobacco? If there is a high index of suspicion, if they need help, the family needs to support.
Sometimes there are really high functioning people who you don't know they're depressed.
Yeah.
So maybe the family can't recognize that, or they don't have a huge circle. What advice do you have for that person in going to get help? Like,
Well,
where should they start with?
that's where the healthcare system needs to come. We all take our cars every 3,000, 5,000 miles for service. Our body is no different. So when they go for their yearly checkup, it is their primary care doctor who needs to screen for mental health, screen for substance use every time they go, and get them help. There comes to the point when in Arkansas, nearly 400 people take their lives due to suicide. That's the other end of the spectrum. We don't want to go that far. Similarly, we have close to 600 people die due to overdoses and substances. We don't go that far. So prevention is the key. Identifying mental health issues or substance use early can prevent them. And there are a lot of mental health resources, both with the Department of Health and DHS. The website, if you go to the Arkansas Department of Health or Arkansas Department of Human Services, there are a lot of mental health resources, mental health clinics. It starts with the family, then goes to the healthcare system to at both points to identify and get them the help they need for both mental health and substance use.
Well, thank you so much for joining me to talk about mental health. It's something that's always been very important to me myself because I grew up almost like depression wasn't, you just need to get over it. It's just fine. But as I got older, I learned like going to a therapist or a counselor is like, oh, wow, you really, like you said, have to take care of your body like you would your car or anything else. So thank you so much.
Sure.
And it was great speaking to you.
Likewise,
Thank you.
likewise. Thank you for being an advocate for
Oh,
this.
no, thank you.
Yeah.